Tisha VASANTH. Yeah. She will be presenting a case of Fraser syndrome. And Dr. Juhi Arora, please be ready for the next.
Good afternoon, everybody. I'm Dr. Tisha VASANTH, and I would like to present a case on a case of Fraser syndrome. Fraser likes to hide but not seek, as I'd like to call it. Okay, so Fraser syndrome is a rare autosomal recessive genetic disorder that is characterized with features such as cryptophthalmos, syndactyly, malformation of the larynx and genitourinary tract, craniofacial dysmorphism, orofacial clefting, mental retardation, and musculoskeletal anomalies. Cryptophthalmos is a rare condition in which the embryonic lid folds fail to develop. The conjunctiva and the cornea are replaced by skin that lines the orbital margins. There are three types of cryptophthalmos, known as the complete or typical type, the incomplete or the atypical type, and the abortive type, which is also known as the congenital symblepharon. The patient who presented to us was a 9-year-old female presenting with the inability to close the eyelids and watering from the left eye since birth. On general physical examination, she also presented with low set ears, hypoplastic nasal alae, micrognathia, bilateral syndactyly, and ambiguous genitalia. On ocular examination, the right eye had a vision of 660 and the eyelids appeared normal. The conjunctiva also was normal. The cornea had total limbal stem cell deficiency and a macular opacity inferiorly. The pupils and the pupils anterior chamber lens were all good, and fundus was also, posterior segment was also found to be normal. And these are the keratometry values, which are K1 was 45.5 and K2 was 49.75. And the refraction correction was +1 spherical and -2 cylindrical at 180 degrees. On the left eye, the vision was PL negative. The eyelids were presented with an upper lid coloboma and an ankyloblepharon. The conjunctiva, the cornea were all keratinized, and the rest of the details could not be made out, the anterior segment and the posterior segment. These are the photographs. The one shown on the top was the right eye, and the one shown below is the left eye. And these are the other pictures, like the other general physical examination photos, the micrognathia and the syndactyly. This is the post-operative photo. So this is a multi-step procedure which should be done for Fraser's, and this is just the first step which has been done up till now. We have only done a symblepharon release and a temporary tarsorrhaphy. What's unique in my case, Fraser syndrome is an extremely rare genetic disorder with an estimated incidence of 1 in 1 lakh to 1.4 lakh live births. As it is an autosomal recessive condition, it is more common in populations where consanguinity is more prevalent. Generally, this condition results in severe impairment of vision, but in this case, the right eye had a relatively better visual acuity, thus improving the patient's quality of life. The associated skin folds also provided a good anchor for the tarsorrhaphy sutures and also showed a little bit hope for the further steps in management, such as creating a conjunctival sac or a fornix also. Clinical implication, the significant vision loss is associated with this condition depending on the type of cryptophthalmos. Increased risk of infection due to defective eyelids as the protective mechanisms are also compromised. Psychosocial implications due to disfigurement and potential vision loss causing hardships in social integration. Monitoring and long-term care is often needed to tackle the complications associated with cryptophthalmos and other systemic abnormalities. Take-home message. The defects of Fraser syndrome requires a multidisciplinary approach to improve the patient's functionality and aesthetics. This case shows the need for early diagnosis of Fraser's in order to improve in order to prevent further keratoconjunctival exposure in cases of incomplete cryptophthalmos. This also shows the need for surgical intervention to prevent features of exposure keratopathy and reduce the risk of infections. Prosthetics also play an important role in improving the quality of life for the patient. No financial disclosures. Thank you.
Very nice presentation, Dr. Tisha. Just one thing I want to ask. You mentioned that the patient had ankyloblepharon as well.
Yes, sir. That was also like considered.
Usually, there's a stark difference between a cryptophthalmos and an ankyloblepharon. Can you just highlight it, if you can, if it's possible? Do you know what's the difference between cryptophthalmos and an ankyloblepharon?
Yes, sir. Clear. Ankyloblepharon is just where the eyelids are adhered. It was very laterally, so
Okay.
we didn't do an excision for that.
What
Is
I
the
am
lid
trying.
formed or not in
Yeah.
cryptophthalmos? I think let's simplify the question.
Based on the type, ma'am, it is usually not formed very
So we are
properly.
talking about your case.
Yeah.
You mentioned there was ankyloblepharon. That's why he's asking this, because usually what happens is there is a continuation of the skin and the conjunctiva, and there is
Yes,
no
ma'am.
lid. So doing actually a symblepharon release was of no use. The cornea was already keratinized. If you really wanted to do a fornicel reconstruction, you need grafts and you need to reconstruct the lid. Doing a dasurrhaphy will not help. So anyway, it is not your fault. It's okay.
It's okay.
You just picked up the case and you wanted to show the findings, but that is not the way to go about.
Okay.
Right?
There's there's an obvious thing that there's a difference between the stage of development as well. Okay, there are 4 stages of development of eyelid.
Yes, sir.
So what are the stages? Do you have any idea?
Yes, sir. The
Fold
optic-
formation, fusion,
Yes, sir.
then separation, and lastly the maturation stage. So whenever there is a fusional problem or even the fold formation, that gives rise to an abnormality in the development of cryptophthalmos. Okay. However, when it comes to the difficulty in the maturation phase, when the separation is not completely occurring, where the lid is completely formed, otherwise the lid structure, the tarsals and everything, the mesenchymal tissues have already been there. Only there is some attachment between the upper and lower lid. That is ankyloblepharon. So ankyloblepharon can be of different types as well, I guess.
Yes,
So okay. So ankyloblepharon is a completely separate
so it was
entity.
contradicting technically.
Yeah. So that's why. Otherwise, nice presentation.
So take home is that for any postgraduate student, the diagnosis has to be well. You need to know all terminology. Fine. And in this presentation, when you were describing the clinical findings, there were no clinical photograph available to us to correlate those clinical findings. You just have shown one clinical photograph in the end. But whenever you're presenting something, all clinical findings, you at least have a photograph so that it can
Correlate
it is
and then you can
properly
make more sense.
correlated, so that you
Yes.
are clear and anyhow. Thank you very much. Thank you.
Thank